So functional consequences are basically observable effects of actions, risk factors, and age-related changes that influence quality of life or day-to-day activities. So they relate to levels of functioning, including body, mind, and spirit. So all three different types of functionality and how they impact quality of life and day-to-day functioning. Those negative functional consequences are those that interfere with functioning or quality of life, while positive functional consequences are those that facilitate the highest level of functioning, the least amount of dependency, and the very best quality of life. A functional assessment is different than functional consequences, so keep those two separated in your head. We will come back to functional assessment over and over throughout the semester, so you'll hear more about it. Functional assessment is an assessment piece, so it's just that one part of the functional consequences theory. Remember when we looked at this model and we see nursing assessment here at the top? Nursing assessment in that orangish colored box really is where functional assessment goes. So what does our patient look like? How do they function? And what works for them and what doesn't? So functional assessment focuses on the older adult's ability to perform activities of daily living. So activities of daily living are getting dressed, bathing, combing your hair, going to the bathroom, ambulating, and then also those activities can affect survival and quality of life. If I can't do those activities of daily living by myself or independently, I'm going to need someone else to come in and assist. And typically that decreases quality of life for individuals. Functional assessment provides a framework for both research and methods of planning healthcare services because it allows us to determine where an individual is, and then we can pull in research and health services to meet the needs of each particular individual. So we end up with a very individualized plan of care for each person. And it's a very important component. So, very important component in the care of older adults. Highlight that. Know your functional assessment. Remember that functional consequences theory is much more broad because it distinguishes age-related changes, it focuses on consequences on assessment, it leads to interventions, and it leads to wellness outcomes. So I would use the theory in order to plan my overall approach and care for an individual. I'm going to pull all of these pieces together that are part of the theory in order to plan care overall. So it's very broad. It tells me that I need to pay attention to social, mental, environmental concepts. I need to make sure I do a good assessment, and then I need to evaluate what the consequences are of both risk factors and negative healthcare behaviors. Functional assessment, like I said, is just that one piece of the overall theory, and it does provide us a good base, but it is much more narrow. So the functional consequences theory is broad. It provides a framework for us to move forward on. Functional assessment is a small part of the theory that gives us the base to establish where we need to go from here. Here's a diagram of all the different aspects that we need to consider when we do a functional assessment of an individual, looking at emotional, intellectual, physical, social, environmental, financial, and spiritual needs. So very holistic. You can read the definitions to each of those categories on this slide as you would like. It's important to make sure that we do consider all aspects and not just one aspect, which is typically physical when we make a move of a resident from one living style to another, like from home to a nursing home. Maybe the physical needs is what's driving it, but we need to consider all the other aspects as well. Health promotion for older adults. This is great. Health promotion programs, they're interventions that focus on behavior change. They're directed towards improving health and well-being. We can do a health promotion activity that focuses on individuals, on groups, on a community, or an entire nation. It just all depends on what their environment and social structure is. So we can do all different types of things, from exercise, nutrition, screenings and preventative services, stress reduction, spiritual growth. All of these come to play in health promotion activities. When we have here at the university every year, they will have a kickoff with the new year and have some physical fitness competitions to help get more steps in or to work on yoga for the year, and they help us as employees of this facility to engage in different health promotion activities. And those are types of things that are worked into the structure and culture of our environment. So here, as an employee of the University of Missouri, I may have several things that I have access to and that I can work with and that are expected of me. If I worked in Japan, that would be set up differently. And the Japanese culture really engages in stress reduction and physical activity as a part of the normal workday. And oftentimes that is so much integrated into the normal workday that certain break periods have been set aside just for those activities, and you'll see the entire group of employees doing those activities at the same time. Health promotion for older adults can also involve some other health promotion activities or interventions. I mentioned screening programs. We can do a lot of different screening programs, like hypertension screening, cognitive screening, osteoporosis screening. We can do risk reduction interventions, such as exercise programs, environmental modifications, lowering the kitchen cabinets because a person's now in a wheelchair so that they can reach what's in the cupboards. And it could be health education. So we can think of health promotion as being very holistic as well, and that it would cover a great variety of different topics. Strategies for improving health of older individuals. Again, we want to look at healthy lifestyle behaviors, injury prevention. We definitely need to pay attention to culturally appropriate services, and we'll get more into that at a later lecture. We want to discuss immunization and preventative services and self-management techniques. So one of the things that has come up from our federal government is from the U.S. Preventative Services Task Force. They had an advisory committee on immunization practices. Then they wrote a report on this, and it's called Enhancing the Use of Clinical Preventative Services Among Older Adults, Closing the Gap. It was published in 2011, and it examined 8 services with sufficient state and national data to determine where the gaps were, what were we missing as far as preventative services go for older adults. One of the things they saw that was missing was vaccinations, and there are several vaccinations that are recommended for older adults at this time, and those vaccinations are able to prevent or lessen certain conditions that can be really helpful. So these recommended services, I think there are about 8 of them on this slide and the next slide. that are recommended for older adults. Some of them are recommended for younger adults too, but they're definitely recommended for older adults. So the annual influenza vaccination is recommended for all persons aged 6 months and older. Older adults can get the maximum strength dose, or they can get a dose in the fall and a dose again in the spring. Influenza impacts the young and the old most severely, and so when it strikes, typically we have more hospitalizations of those young persons and then those that are more frail. So it's important that we prevent that if possible. Now we know that this year, for example, the influenza vaccination isn't covering as much as they'd hoped it would, but they basically make an educated guess on what the vaccination should contain, because there are so many, hundreds and hundreds and hundreds of strains of influenza that could come through. And so they make that educated guess months in advance so that they can start producing enough vaccination for everyone across the country. But every little bit of immunization can help and boost the immune system. Pneumococcal vaccinations of persons 65 and older, and anybody who hasn't been vaccinated. So every 5 years, although I believe they've just changed that to 10 now. So people should have that vaccination at least every 10 years. If they are 65 and haven't had it yet, then they should consider having that done. A screening mammography every 2 years for women aged 50 to 74. After the age of 74, certainly you can go and have a mammogram done, but the benefits don't outweigh the costs once you've reached that age. And so it's okay to stop. If you're worried about it, it's okay to continue as long as you have the funds to cover those costs. An annual colorectal cancer screening using a variety of methods. One of those is a fecal occult blood testing or colonoscopy up until the age of 75. Screening for type 2 diabetes, even if you're asymptomatic, but especially if you're asymptomatic and have sustained high blood pressure. For men, lipid screening if you're 35 and older. Women, that starts at 45 and older, and only if they're at an increased risk for heart disease. Osteoporosis screening for women 65 and older, and routine women beginning at age 60 if you have increased risk for osteoporosis or osteoporotic fractures. Always ask adults about tobacco use and provide information about cessation interventions for those who do use tobacco. There's a couple of models, and we'll really just talk about one here, but for health behavior change, for health promotion, all health promotion interventions require some change that needs to occur, from detrimental health-related behaviors to those that enhance wellness. And it takes some fortitude and persistence of the individual to make those changes. So the trans-theoretical model has stages of change, and there's 5 stages that the person goes through. So first of all, there's pre-contemplation. You're really not aware. That could go on for years and years and years. The second stage is called contemplation, where you intend to change. And the third stage is preparation. You might still be wondering if, should I do it? Should I not do it? Or you might have some times of success and a couple of failures in there. In the fourth stage, you actually make consistently that behavior change. And the fifth stage is maintenance, where you continue that healthy behavior throughout your lifespan.